Hi everyone, my name is Jessica and I'm the nurse coordinator at STL Fertility. In this video, I will be showing you how to prepare and administer Menopur. Menopur is one of the medications that will help stimulate your follicles to then eventually get those eggs out at your retrieval. The first step in any injection is to ensure you have proper hand hygiene. To do this, you will want to use soap and water and then dry efficiently. At that point, you can then gather your supplies for your injection. To prepare Menopur without a Q-cap and with a needle, you will need the following supplies. You will need an alcohol prep pad, a 3 ml or 1 ml syringe, your injection needle, a longer needle for mixing, your vial of normal saline water, and your Menopur vial and a sharps container. To prepare Menopur with a needle, the first step is to take your 3 ml or 1 ml syringe and your longer needle. You will attach this by twisting on. You will then remove the cap off of your needle. You will then take your saline vial and pop the cap off of the top of the vial. You will then place your needle inside the vial and invert, making sure your needle is below the water, and withdraw 1 ml of water. You can then remove your saline vial. At this time, you will take this liquid and go to your Menopur vial, removing the cap and placing the needle in the hub and pushing the liquid into the vial. You will then want to see that this is diluted to be clear. Once it is fully diluted, you will then again invert the vial, making sure the needle is below the liquid, and withdraw all the liquid back into the syringe. Once you have the liquid in the syringe, you can then remove your Menopur vial. You can also twist off your needle and place this in your sharps container. You will then attach your injection needle, and then you will want to push up to ensure there is no air or bubbles on the syringe by flicking. You will then take your cap off the needle and prime your needle, and by doing this, you will watch to make sure there is a small drop at the end of your needle hub. You are now ready to administer your Menopur. We are now ready to administer your Menopur subcutaneously. To do a subcutaneous injection, you will go 2 finger widths from your belly button to the left or right, and you want to stay at the level of or a little below. It is important to alternate sites after every injection just to give one side a break. The first step is to take your alcohol pad and clean your site in a circular motion. You will then take your medication, removing the safety cap. You will then pinch your skin and at a 90-degree angle, inject the needle fully in. Release your pinch and slowly push the medication in. Once the medication is in, you can then release the needle out. I will tell you, Menopur can have a tingle or burning sensation once injected. Do not be alarmed, that is normal. Once your medication is administered, you will then take your syringe and needle and place this in your sharps container. Your physician may decide to do your Menopur intramuscularly. I am now going to show you how to do an intramuscular injection with your Menopur. For an intramuscular injection, you will need a 25 gauge 1-inch needle. The first step is to determine your site. To determine your intramuscular site, we will be doing this in the deltoid muscle. You will find the shoulder bone and go 3 finger widths below the shoulder bone, kind of where you would get a flu shot or a vaccine. You will then take your alcohol prep pad and clean the site in a circular motion. At this time, you will spread the skin taut, take the needle at a 90-degree angle and inject fully in, release, and push the medication into the muscle. Leave there for a second or two and remove your needle. At this time, you can then dispose your needle and syringe in your sharps container. Thank you so much for watching this video. As always, if you have any questions or hesitations during medication administration, please ensure you reach out to your nurse coordinator.